sometimes not in the mood to cook dinner when I get home, so that night we ordered a pizza. And about 11 o'clock that night, we both felt like we had indigestion. I couldn't lay down in the bed because it would hurt worse, so I started pacing around the house, and about 2 in the morning, it just felt like an elephant stepping on my chest.
You know, at 53, you don't think about having a heart problem.
Right,
So.
that was the furthest thing from my mind. And I remember them wheeling me down a hallway, and of course I remember them asking me if they could cut my nightgown off. I'm like, sure, whatever, just please make my chest stop hurting. And I remember going down this long hallway and the bright lights above me, and I was actually adding up life insurance policies in my head because I didn't think I was coming home.
So when she actually came to the hospital, they found that she was very hypertensive. Her blood pressure was very high. And I don't think she'd been treated for that or taken medicines for that. That, and also she had changes on her EKG, which were suggestive of a heart attack, and she was taken urgently to the cardiac catheterization laboratory to have that investigated.
She's going into surgery immediately for a triple bypass, and I'm like, what? You know, I just thought she was having a little heart problem thing, you know. I said, no, it's a major surgery. So I knew just from the professionalism of him, how he projected himself, so I knew she was in good hands.
Initially, when somebody comes out of the operating room, they go into the intensive care unit. It's specialized, it's called the cardiovascular intensive care unit, and they spend one night there, typically, and if everything's well, they get moved to a step-down unit. They spend approximately 3 to 5 days in the hospital before they go home, and during that time, we're very, very aggressive about getting what's called early mobility, where they're out of bed, walking, doing things as soon as possible, even the same day of surgery. Because the sooner they get up and move around, the sooner they're going to get home.
When I first met Dr. Meyers of UF Health, he was very soft-spoken and gentle because I was obviously emotional. Just really appreciated him coming to me himself and sitting there and speaking with me for several minutes. You know, he took out of his time, so I just felt like the whole UF Health team that I felt was taking care of me, they were amazing.
So patients who need this kind of surgery done are always very anxious. They're very scared, which is who wouldn't be, and they want to be close to home. So I think that's the greatest advantage, is that it's local, it's right here, and you know, there's no reason to go to Jacksonville, there's no reason to go to Orlando. We can do as good a job or better job here.
When I woke up from my surgery, this was laying next to the bed. So I hugged it a lot and cried on it a lot, and all the nurses signed it before I left the hospital, and then when my friends came to visit at home, they all signed it, so it has a lot of signatures on it, and it means a lot to me. But it definitely helped in my recovery in many ways.